Hey guys, Larissa here. So excited to be putting out some video content for your labor nurse YouTube channel. Today I'm going to be starting with a pretty simple topic, something that's done often during pregnancy, and it's called a non-stress test. Again, I am not a medical doctor. I am a current labor and delivery nurse. I'm not giving you medical advice. I just want you to feel informed. So I'm just here to educate, kind of give you information about different things that you might experience during pregnancy, and give you more of a objective idea and platform, because I see lots of women during the day, and it's not just my labor story, it's more of a general perspective. Okay, so today I'll be going over NSTs, which you might hear, which also stands for a non-stress test. So a lot of women have non-stress tests during pregnancy. It's very common, super normal. When a woman comes in, when she is getting an NST, they're either going to be reactive or non-reactive. Reactive is a good thing, it's a positive thing. Non-reactive means the strip didn't look like how we wanted it to. So to walk you through the process and what's kind of happening is they're going to hook you up to a monitor. So the monitor has two separate pieces. One is a toco, which measures the uterine contractions. So that's the part that usually goes up around the belly button. You'll see it kind of up higher. It's where your stomach gets hardened or becomes tighter during contractions. So you may not be contracting, or you may not feel contractions, but the nurse still has to put that monitor on there. It'll kind of be to the right or the left of your belly button, more or less. Then you have the fetal heart rate monitor. That's the one that we have to put the gel on, and you'll hear us kind of searching around with like a really loud clamoring noise. So once we find baby's heart rate, that will stay on there as well, and then we kind of strap them to you so that they don't move. Baby's heart rate is often found lower, so below the belly button, often to the right or to the left, depending on baby's position. As you get farther along in pregnancy, you'll see that tends to move down because baby's moving down, not always, but usually. And then if baby is breech, meaning butt up, sometimes we'll find the heart rate actually above. So don't freak out if you're early in pregnancy and then finding the heart rate above. Baby flips and does lots of things. So just know that sometimes that might mean baby is just kind of a little flipped up. So NST, what is the nurse looking for? What is the purpose? All of those good things. So the contractions are just kind of an FYI. Contractions don't determine if a woman is going to have a reactive or a non-reactive strip. It's really baby's heart rate and how baby's heart rate reacts to either no contractions or contractions. It doesn't matter either way. However, obviously, if you're really early in pregnancy and you're contracting, that will change the ball game. But for now, I'm just talking about the non-stress test. So with baby's heart rate, which is what that fetal heart rate monitor is picking up, we as the nurse are looking for a baseline between 110 and 160. That's an average heart rate for a baby. Sometimes if you're earlier on in gestation, like the 29 weekers, 32 weekers, things like that, you might be a little bit elevated, more in the 160s, but more or less the median is the 110 to 160. The other thing we're looking for is moderate variability. So this is the variability of the baby's heart rate. So we don't want it to be this flat line of 160, 160, 160, 160. We like for it to kind of vary and do this kind of zigzaggy pattern. That's great. I'll be doing another video that kind of explains fetal heart rate monitoring and a more in-depth process, especially more during labor. But for now, I'm just focusing on the non-stress test. So we have a baseline between 110 and 160, moderate variability, and then we're looking for accelerations. So that is when the baby's heart rate peaks above that baseline and it looks like a little mountain. We need 2 of those in a 20-minute period. So if we as the nurse have you hooked up and you have 2 accelerations right off the bat, I have to keep you on for 20 minutes just because that is the rules. That's what we have to do, is have 20 minutes. If it takes 30 minutes to get 2 accelerations, it takes 30 minutes, and that's fine. We're really just looking for the 2 accelerations. Things that can happen during an NST that would cause it to be non-reactive would be any decelerations. So again, I'll go through more specifics on what decelerations are, but basically that's a dip in the baby's heart rate, and that can mean different things. It can mean baby's cord is being compressed. It can mean baby's head is being compressed. It can mean that maybe the placenta isn't getting the amount of oxygen it needs, things like that. So that would cause a the NST to be non-reactive. So in order to have a reactive NST, you have that baseline between 110 and 160, moderate variability, 2 accelerations, and no decelerations. So that's what you're looking for an NST. Why might you get an NST? Commonly done in the office as you get closer and closer to your due date and to your delivery, especially ladies who go over their due date. Another time you'll see it is if you have any medical risk factors that come up or that you already had prior to pregnancy. They might do NSTs more often. If you were to come into the office or the hospital complaining of decreased fetal movement, meaning you weren't feeling baby move as much, we will always do an NST. We'll always put you on the monitor, find out what baby's heart rate is and things like that. So I hope that was helpful. Feel free to comment questions and things like that below on NSTs. Again, if you have more questions on more specifics with the fetal heart rate monitoring, I'll have another video on that. All right, thanks guys.